I actually think that it would be more strange for you to go through a traumatic birth experience and then just be fine afterwards. To go through pain, heartache, being scared, being in shock, going through those things and then just being okay afterwards. I think that that's more strange. That doesn't quite make sense to me at all because we are human. We're human beings. So going through something traumatic, surely there's a response afterwards. So I don't want you to be hard on yourself if this is you. Like if you do find going to the doctors difficult, if you don't trust them, if you do find going to the hospital difficult or you avoid it or things like that, it's the response. It's your response after going through something traumatic. The memories of our experiences live within our body, within the fiber, the tissues, the fascia in our bodies. So then when we see a doctor, see the hospital, get a letter that says you need to go to the GP, that you can get this instant feeling of feeling anxious or not wanting to go, feeling worried, because the experience still lives within our body, which is why it's important for us to process our emotions and feelings around the birth so that it doesn't affect all other areas of our life. And this is why I will always say, and you'll always hear me say, that C-section is not just a physical recovery, it is an emotional, spiritual, and it's an energetic one. It affects all parts of our lives, not only birth. It affects all parts of your life because now you're avoiding hospitals. You don't want to go to the hospital. You've changed your route to work. You don't keep appointments. You don't trust the medical team. Like this affects all parts of your life. I know women that won't go for a smear test because they're afraid of how they may be treated, how the nurse, doctor, whoever may treat them. So it affects a lot of your life, which is why it's so critically important to understand this, to understand how you're feeling, and then to learn how to recover.